And welcome back. Well, people with chronic neck pain can suffer from migraines and fatigue, and doing simple everyday things can be awkward and strenuous.
Joining us now to talk about artificial disc replacement for the cervical spine is Board Certified and Mayo-trained neurosurgeon Dr. Shekhar Dagam. Great to see you again.
Best name ever.
Well, thank you.
Let's talk a little bit, because it's like, it sounds all complicated, like the artificial disc for cervical spine problems. And I know we have a picture to kind of help us illustrate what you're talking about. In fact, right here.
Sure. An artificial disc is just an artificial joint, just like a hip or knee joint, but it's for the spine. It's been around for many, many years, but it hasn't been available in the U.S. until about 2007, and now we have it more available because insurance companies are coming on board, and there are some newer techniques and technologies associated with the artificial disc that help more patients nowadays.
You know, why is it a great surgery? Because a lot of times I think people do anything to try and avoid surgery of the neck and back, but it can be unavoidable at times.
Yeah, I mean, the traditional surgery is a fusion, where you fuse the bone above and below the abnormal disc. What the artificial disc does is it allows you to reproduce the normal motion that you had before. So it lets you take care of the problem and still preserve your normal movement and let you get back to your work and your normal activity faster.
So fusing, you might not be able to have that full mobility?
You're going to lose some mobility with the fusion. And fusions are good surgeries. They've been around forever, and sometimes they're the better surgery. But in young people or in people who are active, this is a much better operation.
And this has been around for how long?
It's been around in Europe for a long time, and there have been a lot of studies and trials for many decades, but it hasn't really been available commercially until about 2007.
So is the reason that it's a little more available now because insurance companies are embracing it, or is it not covered by insurance?
No, it's definitely covered by insurance. We wouldn't be able to offer it if it wasn't. It has taken time for the insurance companies to come on board, and now it's become much more accepted by insurance companies.
Who's a good candidate for this type of surgery?
It would just really be most people. Most people are good candidates. I think the best way to think about it is who isn't a good candidate, and that would be someone who has like a fracture. If you have a fracture, you don't want to do this. If you have really bad osteoporosis, or if you have cancer or an infection. But other people who have just regular old neck disease that just doesn't respond to injections or physical therapy, they can be great candidates for this.
Well, I was talking to you during the break that my brother has a bulging disc in his neck right now. He's got a bone spur, and it's causing so much pain. He's been out of work. He's had the cortisone shot, and it's really not giving him enough of his life back. He's still not able to do a lot of his work, and you said this might be something for him to ask about. What about recovery? If someone were to choose this kind of disc replacement surgery, what's the recovery like, and how does it compare maybe to the fusion surgery?
Yeah, I mean, it's hard to believe, but the recovery is actually faster.
Really?
Yeah, it's a similar operation, but the recovery is faster, and I think it has to do with the fact that they're able to get the motion back right away. In the fusion surgery, you have to wear a hard collar for 6 weeks. With this, you can wear a soft collar for 2 weeks and then just get back to your normal activity. People get back to work faster. They feel less pain. And this is in my own experience, not just studies that I've read, but this is my own patients feel like they're getting back to their normal stuff faster.
And speaking of getting back to normal activities and back to life and having a quicker recovery, what type of success are you seeing with this type of procedure, and does it seem to last?
Yeah, I think we've been doing it just for a couple of years now, so I can only tell you what the results are for 2 years. But in Europe, they've been doing it for many years, and they say that their studies go out to at least 4 or 5 years, and those patients are extremely happy. You know, it's better than 90% success rate.
That's fantastic. And I would guess that that's very satisfying for you when somebody comes back and says, hey, I'm able to work, I'm able to golf, I'm able to play with my grandkids again, I'm able to get back to the things that I love. You're really giving them a quality of life back.
Absolutely. I mean, I think that in general, they're just happier patients than the fusion patients are. And again, we don't want to say the fusion is a bad operation, nor is it not appropriate in certain situations. But I think that if we present both options to the patient and see where they're a better candidate. I think that's the best way to decide which is a better surgery.
Are you okay with offering people a second opinion too if they've already been seen by another doctor, just to kind of explore their options?
Absolutely. I think second opinions are very important. We make sure that we give them all the information just so that they're fully informed. That's it.
I think it's fantastic. I mean, for somebody who's not able to do the things that they want to do anymore, to be able to give that gift back to them is a huge deal. So much pain. I know my brother's a bear right now because he's in so much pain and he's got to get out of it. So you got to meet with someone. You can meet with Shekhar Dagam by visiting this website. It's dagamneurosurgery.com, or call the number on your screen. You can get a second opinion as well, welcomed there at 414-385-7150. You're located right on Kinnickinnick River Parkway in Milwaukee. Thanks for being here.
Thank you.
Doctor, thank you.